Welcome to yet another video of Acharya Nidana Academy. Today we are going to discuss concept of Srotomula, one of the very fundamental of Ayurvedic pathophysiology. Before going to the description, let us discuss some of the concepts. First, if you know about the physics, chemistry, and biology and fundamentals of Ayurveda, then any of the information can be learned with deepest understanding. Second, we have to practice the concept of minimalism. That means we have to take one particular small topic and on multiple directions we have to think on that particular topic and we have to discuss among these short groups. So this will be giving us the more deepest understanding because each and every person has his own thinking habits. Based on that, the person in a group as such, the person will be getting many ideas or many informations on that particular topic. That is the benefit of practicing the minimalism or practicing brainstorming session. Third, so if you are knowing the Kriya Sharira from each and every corner, then learning Roganidana is not at all a difficult thing. Whereas if you know about the each and every corner of Roganidana, then practicing or learning or knowing the Kaya Chikitsa is not at all a difficult thing. Fourth, whenever you are learning any new information, not only related to Ayurveda or medical information, any information if you are going to learn, try to identify the pattern. So that means you have to identify what actually that is happening. So in a series of sequences, you can able to make out. And so that we can able to modify the pattern. Suppose if it is any kind of in terms of the medical practice or Ayurveda practice or lifestyle practice, there will be some kind of the change that has happening that is leading to the disturbances. We have to avoid it. That is a modification of a pattern should be there. And so that restoration of the health can be done by creating a new pattern itself. Which are the mottos of this particular Acharya Nidana Academy? Let me give you an example for this. If a person is continuously consuming, for example, 300 ml of sour buttermilk for a period of 10 to 12 days or 15 days, so that is actually responsible for the increase of the Pitta dosha in the body. The reason is this particular sour buttermilk will be having the Tejo Mahabhuta, or what is the one of the 5 fundamental principles, that is fire, among the Pancha Mahabhuta that is being present in that particular sour buttermilk. If a person is continuously consuming that, definitely he will be having the clinical manifestation based on that particular sour buttermilk consumption, such as burning sensation in the gastrium, sore eructations, or the headache, etc., specifically in the noon time or at the midnight. Sometimes the reddish colored skin manifestations, skin lesions that can be observed. So these are the different aspects that we can observe. For that, what we have to do? We have to immediately stop it. Consumption of sour buttermilk should be stopped with immediate effect. That is a pattern modification. And later what we have to, so new pattern we have to create, that is consumption of the buttermilk or milk which is not having sour taste. That is the pattern creation. So that the initially we are going to identify what actually abnormality is happening and what has to be stopped and what next has to be created. These are the mottos of this particular academy, that is identifying a pattern modification, pattern creation. Lastly, no compromise on the fundamentals of Ayurveda that will be done in this particular channel. Next, so regarding the gathering the information, that is we have to gather the information as a whole. That is just like the railway track. On the one side we are going to have the Ayurveda line of understanding, and on the other side we are going to have the Western information, current information. So that means we have to learn the informations from that particular angle only. That means we have to bridge the gaps on Ayurveda information and we have to bridge the gaps in the Western information. And after that, So you have to connect the informations at regular intervals, so that if we are able to connect it from the first step to the second step, third step, fourth step, fifth step, then we are moving in the right direction. That is the in that way we have to gather the information. And one thing regarding the, as far as learning the Ayurveda is concerned, it is just like learning a new language. Whenever if you are learning a new language, we are not going to read big textbooks as such. We are not going to have the what do you say, the much complicated words. We are going to learn simple words at the beginning. Then we are going to add new information to that particular already known information, because it is actually, what do you say, that the chain, that is making a chain, we are going to learn new information. So with this, we are going to have the today's topic proper. When you are saying Srotomula, it is having two words, Srotas and Mula. Srotas means it's a channel, or sometimes it has a wide meaning. Some will say it's an orifice, some will say it's a small structure or a cell or so, some will say it's a tubular structure, some will say it's a meshwork, like that. So, and let us assume it's a tubular structure as such. Whenever it's a tubular structure, it definitely has to have two ends, one end and an other end. Here, we are having the point A and point B. Suppose if you are considering the whole as the Srotas, which is having 5 different organs, 1, 2, 3, 4 and 5. When you are having an exposure at the point A, naturally it will be moving towards the point B. When you are having that particular way of movement of the pathogen, definitely the initially we are going to expect the clinical symptoms in point 1. Then we are going to expect the affliction in point 2, 3, 4 and 5. Whereas if an exposure of etiological factor is happening towards the B, then we are going to have initial affliction on the point 5. Then we are going to have a affliction at point 4, point 3, point 2, point 1. So like that, there will be an affliction. Suppose if there is any injuries happening at the 3, then in that particular situation, so we have to know what is normal course of the movement from point A to point B. Is it from the point A or point B? We have to identify. If there is the point A is there, then in that particular situation, if there is a point A, movement is point A to point B, the first and foremost affliction will be, though it is happening in the 3, we are going to have the symptoms of this point 3, point 4 affliction we can see, and point 5 affliction we can see, and lastly we are going to have the affliction of Srotomula point B. Suppose if the movement is happening in this direction, point B to point A, initially point 3 that will be afflicted, then point 2, then point 1 we are going to see, then last point A will be afflicted. In that particular situation, point B may not be afflicted. So like that, we have to learn this particular Srotomula in this way. Let us give an example. So let us take the Pranavaha Srotas. Ayurveda says Pranavaha Srotas is having two Srotomula as per Charaka, that is Hridaya and Mahasrotas. Hridaya is the one which is considered to be the chest region. Probably we can say it is an heart in between the two lungs that is situated. And Mahasrotas, it is the one which is considered to be whole alimentary canal. As per Ayurveda, Mahasrotas is comprising of 3 main Srotasas: Pranavaha Srotas, Annavaha Srotas and Purishavaha Srotas. So here, wherein the Mukha, Kantha and Griva, they are having the part of Mahasrotas. Suppose if a person is having the cold air, there are two possibilities. These cold air that may enter either through the nose or through the mouth. If at all, if that is happening through the nose, naturally the clinical symptoms will be initially be seen in the nose and pharynx, etc. etc. If the uh, cold air is entering via the mouth, not in the nose, in case of nasal obstruction, etc., the symptoms may be observed in the oral cavity, then the pharynx, etc. That may not enter into the alimentary canal, because when the person is having the entry of air, that particular alimentary canal that will be closed by epiglottis. Straight away the cold air will be entering into the larynx, then trachea, etc., and alveoli, etc., that will be moving. In that way, the clinical manifestation, the any kind of pathogen entry, if it is happening through the cold air, in this way it will be moving. And it is being said that if a person is suffering from the chronic respiratory disease, sooner or later the person may have cardiac disease. The term they use in the Western medicine that is being used, that is cor pulmonale. Suppose if the pathogen entry is happening through the heart itself, that means the initial clinical manifestation that is responsible for the backward movement of the any kind of the pathogen, including the blood, etc., that will be entering in the pulmonary capillaries. From there, it will be entering into the alveoli, as these are considered to be foreign bodies to the alveoli, that is considered to be responsible for the irritation, responsible for the cough with sputum, that too which is having the frothy as well as pinkish nature. This particular frothy in the sense because of the presence of air, and pink in the sense because of the presence of the RBCs, which are transferred from pulmonary capillaries into the alveoli. So that is, as they are considered to be irritants, they are moving via griva, kantha and mukha. That is how this is the clinical manifestation that may start from there. Initially that is seen in the hridaya, and afterwards that is seen in the point A in the form of cough with pink frothy sputum. If the person is having the entry of this pathogen through the mouth, that is responsible for the affliction in due course of time, that is point B, that is here in this occasion, that is hridaya. So the take home messages from today's discussion will be: depending upon the nature of Nidana, its entry to the body, Srotas affliction start to take place. Depending upon the nature of the movement of morbid dosha, the Lakshana start to appear and manifest in one Srotomula. Depending upon the rapidity of movement of the dosha, morbid dosha, affliction of the end of the another Srotas, that is the second Srotomula, that may be afflicted sooner or later. Dear friends, what are the major key takeaways from today's message? So mention below. And what are the other areas, other information would you like to have more and more exploration? Mention below. And if you are liking this video, if you are truly liking this video, then share this to maximum number of people, maximum number of the Ayurveda enthusiasts, so that we can make a movement out of this particular small message. Let us create a society which is concentrating more on regularizing their lifestyle. That means which are responsible for the pattern creation, pattern modification, pattern identification in the Ayurveda lifestyle. Thank you.